Okay, team. So today we're actually going to do the insertion of continuous glucose monitors. So this is something I'm really excited about because I've been so curious about blood sugar over time, what happens when I sleep, what happens when I eat something, and I'm really excited about this. So these are the Freestyle Libres. They're 14 days, and they're little pad that goes on your arm. And this is what I'm not looking forward to, is I am very scared to actually do it. I've never done it before. And we'll show you the little, Jesse's gonna insert it on me. This is the needle that's going in. Is that teeny tiny thing right there? I'm hoping it doesn't stay in there. I don't think it does, but we're gonna find out, and I may scream or pull it out. But yeah, so, and then I might do it on Jesse depending on how bad it is. But so what you do is you have to do it on the outer upper arm, and you want to do it in like a fleshy part. So this is harder for men. So you'll see on him, he actually has less fat, but I have some fat right here, and that's where he's going to do it. You also want to do it on a place, like you don't want to do it too far in the back where it may rub on like your seat. Or when you're sleeping. So you want to do it in like an area that maybe is going to be less easily pulled out. I do have quite a few patients who use these, and they've said that they have pulled them out a lot, like on their car seats, when they're sleeping, when they're showering, they are drying off, they just kind of like rip them out. So I might put Tagaderm on over the next 2 weeks to keep it on there, because I'm so curious and I don't think I can handle this twice. So Jesse's gonna clean it, and I'm gonna try and relax. Yeah. And he's desensitizing my nerves a little bit. Let it dry a second. Oh my god. And then the thing about this is that you can't hesitate. And you can put it flush with my skin, but don't push it in yet, because I'm not ready. And I think you need to go up a little bit. And when he's ready, he's going to push it in. Oh. Oh, that was actually nothing. Is the needle in there?
I don't know. I don't think so.
It hurts a little bit, not going to lie. So hopefully we did that right. But it actually didn't hurt. So that's cool. Now, you ready for yours? That didn't hurt at all.
Okay.
Did you get an alcohol pad for you? Okay, how exciting is this? Okay, so there's two parts to this. So this is an actual sensor in here. You have to get it out, and this is the little plunger thingy. So you have to open this, and of course, if I was doing this on you, I'd be wearing gloves and whatever. But this is my husband, so I can't transmit anything to him. He can't transmit anything to me. So then you take this off, and all of this is sterile until you open it. And then if you can see in there, that's the sensor. So we got to get the needle in it. So that's what this part is. And so you line it up, and then you have to push it down, get the needle in there. And then this part you don't need anymore. So there you can see the needle is in there. All right, so let's clean this. He wants it on his non-racket hand because he's a squash player, a racquetball player. So you can see like on here he has less fat to work with, but honestly it didn't hurt at all, so that's very exciting. What? No, it didn't hurt at all. It hurt a little bit afterwards, but I'm not. So you just line it up flush. I'll show you what I'm going to do it. So you just line it up. It's just a little scary. And then you don't want to flex, so he needs to really relax. And then how's that? Would that be okay if I did it right here?
I don't care.
Feel okay right there? All right, 1, 2, 3.
Oh, it did not hurt at all.
Yeah, it didn't hurt at all. Cool. So these are for 14 days. We might put Tagaderm on to keep them on there. I don't know if they'll easily come off or not, but I really want to keep it on there for 14 days. Yes, mine's a little bit lower than yours is. Yeah, I don't feel it at all.
Yeah.
So we can still work out.
Nice. Those actually.
Yeah. Yay. Okay, follow us and we'll post all of our results.